Everybody that we get vaccinated, it's that one person closer to herd immunity where we can get out of this pandemic. Well, this was obviously the biggest public health challenge of modern history. How our team reacted, how our team rolled up their sleeves, how our team just did whatever job was needed was just amazing.
This is what public health is meant to do, and when there is a pandemic and you need boots on the ground, that's what we do really well. I mean, I won't lie, there were definitely days where I think it was just a blur and it felt like there wasn't enough time in the day because there were so many needs and so many pieces that had to come together.
As it played out, it was a year that felt like 5 years. It was all a learning experience.
We like predictability. We like to be evidence-based, research-oriented, and we didn't have that.
June 12th, I'll never forget, we had nobody in the hospital, and we were able to provide testing to everyone in any given day. For that one day, I remember saying, we can do this. We can beat this as a community.
When we heard they were going to be available, done and done, people, let's go, let's get them. And then it was interesting to see how scarce the commodity was.
There wasn't enough supply to meet demand. So everybody who really wanted a vaccine that day. People wanted to know, where do I get my dose? How do I sign up? And we just didn't have good supply. In short order, that was really remedied quickly. So once we started seeing more providers able to provide the vaccine, more clinics set up in the community, it really was a game changer. And the mood that you saw in the community and in the department just really was elevated.
I'm very excited. I'm very excited, especially to protect myself and my friends and my family and be part of a really important cause.
I have a family and all the people around me don't want to contaminate anybody else.
It was, let's just get this job done. We'll do whatever it takes. The more vaccine we could get out, the quicker we could get back to some sense of normalcy, and it gave everybody hope and energy.
All right, so this is our vaccination area. So each table we've got 4 vaccinators. Today is 450 students coming through. We hope to do similar tomorrow.
It feels good. It feels good to have it now. You know, I feel like I'll be a lot safer when I go home and not have to worry too much about all that.
It almost makes me want to cry because we've been through such a hard year and the students have been phenomenal. And to know that we can give them an opportunity to be healthy and safe and to come back and do all the things that students love to do, that's just going to make all the difference.
It was good, didn't hurt at all.
Our students want to be back on campus. So part of our mission is making sure that we're the spot for opportunity for students. And we can do that best when we get campus open.
At the height, we were doing close as a system to about 8,000 to 9,000 shots a day.
Initially, it seemed like we would have a lot more bang for our buck. Doing 1,000 dose events and things like that was really the way to go. But we never lost sight of the fact that as a local public health agency, we do some gap filling and we do reach out to underserved communities. So we always made sure that there were options for us to be going to the community in a trusted space, in a place that's convenient and trusted for them.
Boy, it's all about equity, and we made that a high priority from the beginning. And we're like, where do we need to go? Where are we seeing under-vaccinated rates to make sure everybody can get this free life-saving vaccine?
You know, we realize that oftentimes marginalized groups, they're not always at the table. I don't think we do the best job we can to be inclusive and also to allow for meaningful opportunities to engage.
Our biggest goal is to actually get with community to solve equity problems.
A lot of these businesses didn't have a clue when they were going to be able to vaccinate the people, right? So what I have done is I identify a couple of leaders in the different communities that we work with, and working with them, they give me access to that. They help me in the process.
This is, a big thing for us because we're helping the community, to have easy access to the vaccine.
Pues nada más que vengan a vacunarse, que es solamente el miedo que tenemos al principio, pero pues que es peor el miedo a la enfermedad y que pues hay que intentarlo todos juntos para salir de esto.
Public health has been amazing, giving us this type of support. I mean, everybody's excited that this is happening here. We understand that this is a process that is going to take time, but the level of engagement and the partnership is what bringing people that hope.
Porque ya quiero volver a que ya esté todo lo normalidad, que esté todo normal, salir y disfrutar. la vida, porque pues vida nomás hay una y hay que disfrutarla al máximo.
This was kind of based on that model of identifying a location with community that they trust, that they feel comfortable getting vaccinated at.
The heavy lifting is right now. We have more vaccine than people are interested in getting it.
Vaccine hesitancy, it's all about conversations. It's about answering questions.
You know, we can't make people do things, but I think we need to show people the benefits outweigh the risks, and then ultimately, you know, it's about individual health, you know, families' health, grandkids' health, but also about our community health.
We got our shot and it was good. We got our shot, we did it, we got it, and it's good. We want to help the world. And don't be scared. I was a little scared and you might be scared too, but it's really good. I think you guys should get your shot. Spread joy, not germs. Spread joy, not germs.
We have to educate everyone as best we can in their own language, in their own communities, to be better informed.
We're not in the clear here, and with these new variants spinning off, we're not out of this. The more we can get the vaccine out and into arms, the better off we're all going to be.
I don't think that it's over. My biggest message would be that as we increase the number of people who are vaccinated, we really do make this kind of a thing more of our past.
COVID is real, it's deadly, and this is the best thing we can do for those we love.
A big shout out to all of our 19 providers. We're doing a fantastic job here. We've got work to do, but everybody is rolling up their sleeves and we're doing it as a team. So I appreciate everybody's efforts.